Welcome to the SKK classes again. Today I have bring a very special topic to all of you, that is 5 moments of hand hygiene. So these are the 5 moments which you have to follow and you have to do in your hospital if you're working, or in any type of ICU, or in any type of emergency department if you're working there. So first moment is before touching the patient. Before touching the patient means whenever you are going to touch the patient, or you are doing any procedure with the patient, you have to follow the hand hygiene, or you have to sanitize your hands, because you can be the carrier to transfer the infection from one person to another. So you have to do hand hygiene, or you have to do sanitizer your hands before touching the patient. Second moment is before a procedure, or before doing any type of aseptic procedure. So procedure can be any, whether you are going to deal with the patient, or doing any type of procedure, like you are going to assist the doctor in center line insertion, or you're going to assist the doctor in intubation, or you're going to take the blood sample. So whenever you're going to do any type of procedure, you have to follow hand hygiene, you have to do hand sanitization, so that you could not be the carrier to transfer the infection from one person to another. And third moment is after doing a procedure, or having a contact with body fluid. So it's naturally that if you are going to contact with the patient, like during the procedure, maybe your hands should be in contact with blood, or your hands should be in contact with the secretions of the patient. So after doing any procedure, you have to do the hand hygiene, you have to sanitize your hands, so that you could not be the carrier to transfer the infection. Because suppose if you're doing like suctioning of the patient, so you are in direct contact with the secretions, so you are in direct contact with secretions, or if you're going to take the blood sample, so your hands should be in direct contact with blood. So in that situation, what you have to do, you have to sanitize your hand, or you have to do the hand washing, so that the infection could not be transferred not only to you, and could not be transferred not only to other persons, or it can be the patient. Okay, so because sometime what happened, we have to rush, like if you're doing working in ICU or in emergency, you are dealing with one patient, and after that you have to do the dealing with another patient to assist the doctor in procedure. So before doing any type of procedure, you have to uh, assist the you have to do the hand hygiene, or after the procedure is finished, you have to do the hand hygiene. And fourth moment is after touching a patient. After touching a patient means you have contact with the patient, and you have shake hands with the patient. So after that, so if you are shaking hands with patient, so after that you have to you have to do the hand hygiene, or you have to wash your hands properly. Because patient, if patient is in the hospital, why he or she is in the hospital? Because he or she is infected. So in that situation, you have to follow up the proper hand hygiene. Okay. And the last moment is after touching a patient surrounding area. So, what do you mean by patient surrounding area? The patient surrounding area could be any. It can be bed, it can be the IV line of the patient, it can be patient hands, it can be patient bed sheet. So, we can get randomly in contact with the patient surrounding. So, in that situation, you have to be very much careful, and you have to wash your hands properly, so that should not become the carrier. So these are the 5 moments. I'm just repeating again: before touching the patient, after touching the patient, before doing any type of aseptic procedure, before in contact with, or in exposure with body fluid or any type of secretion with the patient, and after touching. And the last one is after touching a patient surrounding area. So these are the 5 moments that you must follow if you're working in any hospital setting or in unit.